relationship that has been central to medical care, that between doctor and patient, is being transformed by technology. This offers the Irish health system the potential to improve patient care by harnessing all the data we can gather for the benefit of patients. In other words, turning data into patient value.
Within healthcare, we have data, but we don't really draw out enough insight from that. So we need better understanding of what's happening right at the patient level, where a clinician has better information about that patient and therefore makes better decisions to support that patient.
There are a number of things you need to do with data to improve healthcare services. First thing is you identify patients, you identify what's important to them, you identify what's driving citizen behaviour and how you can keep them healthy.
Being able to improve the service that's delivered. We put information in place for patient safety, but a secondary outcome of that is we were able to continue to improve how healthcare is delivered, which is really a huge chunk of why invest in technology for health. The challenge is that we're at the starting point. We are a good amount of time behind the rest of the world. It does mean that Ireland can learn such a huge wealth of lessons from other jurisdictions.
We started by realizing that we are not able to exchange data, so we built a technical infrastructure. And we forgot to involve the patients in that. By law, it's mandatory to participate, but we didn't persuade patients by saying it is important that your data is going to another physician.
How are you putting that data to use? You've got to govern it and protect it, be mindful of the ethics associated with your privileged access to data, and balance that against the patient's expectation that data is going to be shared.
There's a culture where people believe in the system that they are continually providing data, but they may not see anything coming back to them in terms of value from that. Whereas we need to move to a culture where people see this as of real value.
And now we are asking GPs to cooperate and say, well, let at least have the patients their own data. But it doesn't make a difference for a patient whether he is at a GP or he is at a hospital. He has the same problem list. He has the same medical history.
There is a vision that you can have where you talk about the patient owning their health information and they decide who looks at it, they decide how their healthcare should be provided. It's a long way to get there, but if that's our starting point, if that's where we want to get to, you can imagine how we could get there.
To find out more about the current issues in how to transform data into patient value, see KPMG's Healthcare Insights online at kpmg.ie.